You, Anisha. And hi, everyone, it's me again. I will be presenting the key finding of the study that we conducted that just got launched right now. So the researchers, as you already know, we've tried to explore menstrual practices and policies among menstruators with disability in Nepal. So who are menstruators with disability? So we have, according to our national census, we have around 29.1 million population in the country. And among them, 2.2% are the person living with disability. And among them, 45.8% are the menstruators with disability. According to the Disability Act of 2017, Nepal government have identified various different types of disability. You can see on the screen as well, it includes physical disability, hearing impairment, voices or speech impairment, intellectual disability, autism, vision impairment, deaf, blindness, mental or psychological disability, hemophilia-related disability, and multiple disability, each with 4 levels of severity. So the objective of the study was to examine the menstrual practices that were being practiced among menstruators with disability and to analyze national and international policies that upholds the right of menstruator with disability. And also to identify effective approaches to ensure dignified menstruation for them as a way forward. Yeah. Yeah. So the study we conducted, it was a qualitative research using both primary and secondary data sources. For the primary data, we conducted online survey, in-depth interviews, focus group discussions, consultations with communities and also government officials, key informant interviews, and community observations. For the secondary data, we've reviewed policies, and reviewed and to review of key international human rights instruments and national policies that were relevant to menstruator with living with disability. You can see on the chart these are the list of international human rights instruments and national policies that we reviewed for the study. So for the key findings, you can see we've identified the findings on individual, family, community, and institutional level. So for the individual level, we can see that menstruators living with disability, they learn something about menstruation in between the age of 7 to 11 years. If we see data, this is there's a bit delay among them as compared to menstruators living with without disability, which is 6 to 9 years. So why the delay? Our study suggests that the delay could be because they've been isolated from everyday conversation within families, and they're not considered as the one to be discussed this topic with. This figure here shows the reaction to menstruation and menstrual discrimination among menstruators with disability, which is very much similar to menstruators without disability. You can see, so the pie chart here shows the reaction to experiencing menstruation before menarche and after menarche, and the emotions where they felt sad, confused, curious, and no response at all. Within families, menstrual restrictions were observed, which were similar regarding mobility, touch, and food, and many more. So family members really rarely discussed openly among themselves on the topic, and some discussions do take place, but they were very much limited among menstruators themselves. Menstrual practices at school. 44% of the participants, they reported that they experienced menstrual discrimination at school. Some even missed school during menstruation. Some were excluded from activities, isolated and neglected, which highlighted a lack of awareness and adaptation at school with the need of people living with disability. You can also extract from the quotation that I've quoted, some of menstruators living with disability, they miss school because they don't have appropriate, facilities that are disability friendly for them to manage menstruation safely and in an accessible way. So at the school, curriculum did not specifically address menstrual discrimination and the needs for menstruators with disability. School initiatives are largely focused on menstrual management only. And menstrual discrimination and needs of menstruators with disability are missing in the school plans, student curriculum, and extracurricular activities as well. We also witnessed that parents of the menstruators living with disability were not included in the school management team, leaving the bigger gap there as well. In the community level, so community programs and discussions or dialogues on menstrual practices among menstruators living with disability were very minimal. And even in the public facilities, WAS facilities were inaccessible. Many layers of visible and invisible menstrual discrimination practices existed in the community level, and mainstream media also lacked programs and a reporting mechanism that were focused on, especially on the menstruators living with disability. So we also conducted a study on the menstrual practices at institutions working on disability rights themselves. So what we discovered was the workplace discussions around menstruation were non-existent. Only few initiatives existed, but they were also limited to pad distribution. And 88% of those organizations that were participated in the study, the organizational policies on menstruation for menstruators with disability were missing. So we concluded with limited awareness among staffs. There were no dedicated funding for menstruators with disability. And among 14 indicators of the dignified menstruation friendly workplace, a maximum of 3 indicators were presented on the institution. And we're talking about institutions that have been extensively working on disability rights. Regarding menstrual health issue, menopause, which is a very primary part of menstruators' life cycle, has been, we found that they were extensively missing, and as we like to quote, a silence crisis. Very low awareness were seen. Participants were confused about the symptoms, stigma, and impact on work. Even those who have ceased menstruation, who have undergone surgical menopause, they were not aware of the symptoms, what's happening with them. Because we found that menstruators living with disabilities, sometimes they try to undergo surgical menopause just to make it easy for them to manage menstruation. So even in that case, they have had symptoms, but they were not aware of the fact that they were the symptoms of surgical menopause. So from the policy review, we found the gap, and those were that the menstrual discrimination has not been recognized in the policies, and the disability and menstrual intersection were missing. And most of the policies that have been identified were mostly focused on hygiene issue. And no disability-focused menstrual education were provided. And even in the National Children Policy, we found that child menstruators living with disability are invisible. To move forward, we've come up with few recommendations moving forward, and they are to recognize dignified menstruation in national policy and establish a full disability inclusive framework. Another, to ensure all public spaces adopt dignified menstruation friendly and accessible WASH standards, specifically for menstruators living with disability, and to integrate menstrual discrimination and the specific need of menstruator with disability into school curriculum and education plans. Last but not the least, to design community programs that raise awareness on menstrual discrimination using a life cycle approach, linking it to unequal power relation and patriarchy. Thank you so much for being a wonderful audience and hearing my presentation. I look forward to the session. Thank you so much.
Thank you, Sarmila, for highlighting the findings from the research. Now, I would like to invite Ms. Meena Poudel from the Nepal Disabled Women Association to share her reflection on the report. Meena Poudel is the chairperson and co-founder of Nepal Disabled Women Association. She is a dedicated development practitioner with over 20 years of experience, specializing in the intersection of gender and disability. Her career has focused on empowering women and advocating for the rights of women and girls with disabilities. She is an expert in this field, focusing on creative, inclusive environments and advocating policy changes at national, local, and international level. Over to you, Meena, ma'am.
गुड मर्निङ एभ्रिवान। सबैमा मेरो नमस्कार र सर्वप्रथम म एकदमै धेरै धन्यवाद दिन चाहन्छु राधा फाउन्डेसन र टिमलाई। यो 3 दिनको यहाँहरूको इन्टरनेसनल कन्फरेन्समा यसको पार्ट आज जुन यो बुकको लन्च भएको छ, रिसर्चको लन्च भएको छ, त्यसको विषयमा र त्यसको विषयमा चाहिँ अलिकति यहाँ मलाई भन्ने मौका दिनुभएकोमा म एकदमै धेरै धन्यवाद दिन चाहन्छु। सुरुमा त एकदमै के भनेर चाहिँ मैले थ्याङ्क यू भनौँ भनेर नै मलाई कस्तो भइरहेछ, तर पनि यो एकदमै राम्रो लागिरहेछ मलाई। जब यो सुने मैले, उहाँहरूले मलाई इन्भिटेसन पठाउनु भयो, त्यो पछाडिदेखि नै मलाई एकदमै खुसी। जुन कुरा चाहिँ अब हामीले जे कुराहरू पहिलादेखि चाहिँ चिच्याइ भनिरहेका थियौँ, त्यो कुराहरूको जुन डिग्निफाइड मेन्चुरेसनको कुरामा कस्तो खालको ब्यारियर चाहिँ महिला, त्यसभित्र अपाङ्गता भएको महिला, त्यो भित्रको पनि विविधता जुन हामीले कुरा गरिरहेछौँ, त्यसमा अपाङ्गता भएको महिलाहरूले यो कुराहरूलाई कसरी फेस गरिरहेछ, कस्तो खालको ब्यारियरहरू चाहिँ छ भन्ने कुरा चाहिँ हामीले भनिरहेको थियौँ, तर के खोइ त एभिडेन्स भन्ने कुराहरू आउँथ्यो। भनेपछि यो बुक जुन आज चाहिँ रिसर्चको बुक पब्लिस भएको छ, त्यो बुकले हामीलाई एउटा बाटो दिएको छ कि अपाङ्गता भएका व्यक्ति, अपाङ्गता भएको महिलाभित्रको जुन विविधता छ, त्यो विविधतामा चाहिँ कस्तो खालको चाहिँ डिग्निफाइड मेन्चुरेसनको लागि चाहिँ कस्तो खालको प्रब्लमहरू, कति खालको चाहिँ स्टिग्माहरू चाहिँ भोगिरहेको छ अपाङ्गता भएको महिलाले। जहाँ अपाङ्गता भएको महिला, उहाँहरूले चाहिँ बच्चैदेखि नै उहाँहरूलाई चाहिँ बच्चाको रूपमा पनि अलिकति धेरै स्वीकार नगर्ने, महिलाको रूपमा पनि स्वीकार नगर्ने, उसलाई त पिरियड नभइदिएदेखि हुन्थ्यो, बरु उसले चाहिँ पिरियड भयो भनेदेखि भोलि के हुन्छ भनेर चाहिँ अझै धेरै हिंसा हुने डर हुन्छ, अथवा हिंसा हुने डर हुन्छ भन्ने हिसाबले चाहिँ परिवारले सोचिरहेको यो समाजमा चाहिँ यो डिग्निफाइड हुनपर्छ र महिलाभित्रको विविधताको कुराहरू उठ्नुपर्छ भनेर जुन यो राधा फाउन्डेसनले चाहिँ गरिराख्नु भएको छ र विभिन्न सेक्टरबाट पनि यसको आवाजहरू चाहिँ उठिरहेको बेलामा यो रिसर्चले चाहिँ पक्कै पनि हामीलाई एउटा इभिडेन्स चाहिँ दिएको छ। यो इभिडेन्सले हामीलाई भोलिका दिनहरूमा र आगामी दिनमा यो ग्लोबल साउथ मात्रै होइन कि हामीले वर्ल्ड वाइड नै यसलाई चाहिँ अझै धेरै यो के गर्नुपर्छ भन्ने कुरामा पनि अझै धेरै यसले सेन्स दिएको छ। अपाङ्गताको विविधतामा हामीले हिंसाको कुरा गर्छौँ, जस्तो कि अब हामी अपाङ्गताको अघि 10वटा जुन क्याटेगोरी कुरा गर्नुभयो, त्यो 10वटा क्याटेगोरीमा पनि इन्टेलेक्चुअल डिसेबिलिटी भएको, डाउन सिन्ड्रोम भएको त्यस्तो व्यक्तिहरूको, त्यस्तो महिलाहरूको, बालिकाहरूको चाहिँ पहिला सुरुमा नै पाठेघर झिकेर फालिदिन पाएदेखि त उसले हिंसा गरे, कहाँबाट डिग्निफाइड मेन्चुरेसनको कुरा आउने। त्यो भएको भएर यस्तो कुराहरूलाई चिर्नको लागि पनि जुन यो रिसर्च आएको छ, त्यो रिसर्चले चाहिँ एकदमै ठुलो हामीलाई भ्यालु दिन्छ र यो कुरा यसमा आएका कुराहरूले हामीलाई भ्यालिडेसन गरेको छ, ताकि हामीले भनेका कुराहरूलाई चाहिँ रिसर्चले बोलेको छ है भन्ने कुरा चाहिँ आएको छ। त्यसको लागि म हामी सबैलाई र राधा फाउन्डेसनलाई म एकदम धेरै धन्यवाद दिन चाहन्छु। यस्तै गरेर अघि त्यो सबै कुराहरू आएको थियो। हामीले स्कुलको करिकुलममा पनि जस्तो कि महिलाहरू नै त्यो स्वास्थ्य पढ्ने बेलामा चाहिँ बाहिर निस्किनुहुन्थ्यो, के अरे बालिकाहरू, उहाँहरूलाई भित्र राखिँदैन थियो। त्यो बेलामा त्यस पछाडि अपाङ्गता भएकोलाई त झन् धेरै राखिँदैन थियो। अनि अपाङ्गता भएको महिला, अपाङ्गता भएको बालिकाहरू पनि चाहिँ पिरियड हुन्छन्, उनीहरूको लागि चाहिँ एक्सेसेबल प्लेस चाहिन्छ, उहाँहरूको पहुँचयुक्तताको अवस्था सुनिश्चित गर्नुपर्छ। जस्तो भौतिक पहुँचको कुरा, टोइलेटको कुरा, त्यहाँबाट व्हिलचेयर जाने टोइलेटको कुरा, प्याडहरू दिँदा पनि कम्फर्टेबल प्याडहरू चाहिँ हुन्छ कि हुँदैन भन्ने कुरा, उनीहरूले लिने कुरा कसरी एक्सेस गर्छन्, अनि सरसफाइको कुरामा धाराहरू कहाँ छ, उनीहरूले प्रयोग गर्न सक्छन् कि सक्दैन भन्ने कुरा, यावत ब्यारियरहरू चाहिँ एकदमै धेरै चाहिँ फेस गरिरहेको अवस्थामा यो कुराहरू चाहिँ हामीले उठाउनुपर्छ र गर्नुपर्छ भन्ने कुरा हामीले भनिराखेको। तर यो रिसर्चले चाहिँ एकदमै ब्रोडर सेन्स चाहिँ दिएको छ। यो रिसर्च साँच्चीकै हामीले अब आगामी दिनमा चाहिँ एडभोकेसी टुल र हामीले जुन अहिले यसले रिकमेन्ड गरेको कुराहरू छ, यो रिकमेन्ड गरेको कुराहरू हामी सबैजनाले चाहिँ यसमा लाग्यौँ भनेदेखि पक्कै पनि अपाङ्गताभित्रको जुन विविधता छ, त्यो विविधताले हामीले भोलि गर्ने काम, इम्प्लोइमेन्टको कुरा हुन्छ, शिक्षादेखि हामी पछाडि जुन पारिरहेको छ त्यो पारिएको कुराहरूलाई चाहिँ अगाडि बढाउनको लागि पनि एकदमै धेरै यसले चाहिँ सेन्स दिन्छ र हामी सँगसँगै यसमा चाहिँ काम गरेर जान सक्छौँ। आगामी दिनमा पनि यहाँहरूले जुन गरिराख्नु भएको छ, कुराहरू उठाइराख्नु भएको छ, यो कुरा पनि अझै धेरै चाहिँ मासमा चाहिँ जानेछ र अपाङ्गता भएका बालिकाहरूले सहज तरिकाले सहज वातावरणमा डिग्निफाइड भएर चाहिँ बाँच्न पाउनुहुनेछ र मर्यादित जीवन चाहिँ बिताउनुहुनेछ। यो एउटा ह्युमन राइट्सको इस्यु हो। यसलाई चाहिँ हामीले छुवाछुत गरेर बाहिर बस र के गर भनेर अरू कुराहरूसँगै भन्दा पनि हामी आफैबाट चाहिँ परिवर्तन हुनुपर्छ। हामी पहिला आफू परिवर्तन भएर अरूमा चाहिँ परिवर्तन गराउनुपर्छ भन्ने कुरा पनि चाहिँ भन्न चाहन्छु। र यो मेन्चुरेसन भनेको एकजनाको मात्रै कुरा होइन, दुईजनाको मात्रै कुरा होइन, यो सबैजनाको डिग्निफाइड मेन्चुरेसन चाहिँ डिग्निफाइड चाहिँ एभ्री वानको चाहिँ बिजनेस हो। सबैले बोलौँ, सबैले गरौँ। एक्सेसेबल इन्भाइरोमेन्टको लागि डिग्निफाइड मेन्चुरेसन सधैँ नै हामी बोल्न तयार छौँ र सधैँ गर्न तयार छौँ। र यो हामी सँगसँगै चाहिँ नेपाल अपाङ्ग महिला सङ्घले जुन काम गरिरहेछ, आगामी दिनमा पनि यसलाई चाहिँ हामीले रेज अवेरनेसको कामहरू र अरू विभिन्न पोलिसीमा इन्टरभेन्सन गर्ने कुराहरू पनि हामी चाहिँ यसमा लागि पर्नेछौँ र गर्नेछौँ। हामी सँगसँगै छौँ भन्दै म एकदमै धेरै धन्यवाद दिन चाहन्छु र राधा फाउन्डेसनलाई एकदम धेरै धन्यवाद। नमस्कार।
Thank you so much for valuable perspectives, Ms. Meena Poudel ma'am. Your insights have really paved way to make the menstruation of disabled women dignified. And thank you so much everyone for your presence in this beautiful session and your energy. Welcome back, and we now move into another deeply human and long overdue conversation or plenary session on a theme that rarely receives space, attention or dignity in public health discourse, that is dignified menopause as a human right, not a privilege. Menstruation is not only biological, it is social, cultural, political experience shaped by stigma, silence, discrimination, and deeply unequal power structures. We will be sharing life experiences and onwards a panel discussion on the theme Dignified Menstruation, a human right, not only a privilege. It's my honor to invite our moderator for this panel discussion, Miss Floriane Klinklin from 𝐸𝐴𝐻𝐿, to describe about her. Floriane Klinklin is a Togolese feminist and the project manager for 𝐶𝐢𝐿 pour la dignité at 𝐸𝐴𝐻𝐿. For 9 years, she has championed social justice and the rights of women and LGBTQ+ people, promoting a decolonial and intersectional feminist approach that bridges grassroots actions, political advocacy, and movement support. 𝐸𝐴𝐻𝐿 is an international feminist solidarity association that supports feminist organizations in French-speaking Africa, North Africa, and Southwest Asia, focusing on advocacy, empowerment, innovation, and SRHR, sexual and reproductive health and rights. So I would like to welcome her.
Merci beaucoup. Alors, moi, je vais parler français. Et j'espère que tout le monde entend, que ce soit en anglais ou en népalais. Alors, bonjour à tous et à toutes. Et c'est un honneur pour moi de modérer cette session aujourd'hui qui va porter sur la ménopause digne. C'est également pour moi l'occasion de remercier Global South Coalition for Dignified Menstruation pour m'avoir permis de modérer cette session et pour le travail abattu. Pour nous, c'est 3 jours de session, de conférence, mais pour elle, c'est près d'une année de préparation. Et cette session, comme on l'a introduit, va porter sur la ménopause digne comme un droit humain et non comme un privilège. Nous allons aborder cette session en 2 étapes. La première étape va porter sur un partage d'expériences et de savoir avec 2 personnes illustres. Et la première personne sera le docteur Vasudev, Chaturvedi, qui malheureusement n'est pas avec nous ici physiquement, mais qui a pu enregistrer une vidéo qui nous sera partagée. Le docteur Vasudev Chaturvedi a consacré plus de 50 ans à faire progresser la santé publique, le développement, l'impact social, avec des organisations gouvernementales, internationales et non gouvernementales. Son parcours l'a conduit à occuper des fonctions d'expert pour les gouvernements de l'Inde, de l'île Maurice, du Ghana et du Sri Lanka. Puis, il a collaboré avec des agents tels que UNICEF, l'Organisation internationale du travail, l'ONU-DI-TBIIP, et après avoir perdu sa femme à des suites des cancers d'ovaires en 2014, le docteur Chaturvedi a fondé Swasthava Cancer Care, une organisation à but non lucratif qui se consacre à la sensibilisation au cancer, au dépistage précoce et à l'autonomisation des jeunes. Grâce à des initiatives telles que Reach Them Young, il a sensibilisé des écoliers, des jeunes et des communautés rurales à la prévention du cancer, à la santé menstruelle et à la dignité personnelle ou à l'hygiène personnelle. Animé par sa compassion et sa vision, le docteur Chaturvedi continue d'œuvrer pour éliminer le cancer du col de l'utérus dans les zones rurales de l'Inde et dans la région de la SAARC. Il promeut également la vaccination contre le papillomavirus et développe des services de soins oncologiques gériatriques pour les patients âgés. Je vous prie de suivre avec moi la vidéo du docteur Chaturvedi. Merci beaucoup.
Namaste. My name is Dr. Chaturvedi. I am the founder and CEO of Swasthya Cancer Care, Hyderabad. We have been into menstrual hygiene program right from the last 2017, and we have been trying to motivate and empower the youth on the menstrual hygiene. Surprisingly, in one of the programs, the girls came forward and told us that we should include boys also in the menstrual hygiene program, since the boys should know that their mothers bleed, their sisters bleed, and also their aunts bleed. Otherwise, at school, when they come, and if they see some spotting for the girls, they tend to giggle because they do not know. So tomorrow these youth will become adults, get married, have children, and they should be made aware of menstrual hygiene right from the childhood. Unfortunately, in India, we don't have sex education in schools. And when we go and talk about menstrual hygiene, even the girls feel shy. This is the unfortunate situation in rural areas. Now, coming back, when we see dignified menstruation is integral to individual physical, mental, and social well-being. Despite the importance of menstrual hygiene in India, menstrual hygiene in India is often surrounded by stigma, misinformation, and systematic neglect. This lecture devotes into two critical facts: menopause and menstrual hygiene issues linked to cancer, highlighting the implications of dignity and health. India, the use of hygiene menstrual products has improved with approximately 77% of women aged in the age group of 8 to 15 to 24, utilizing hygienic methods according to the National Family Health Survey, NFHS 5, 2019-21. However, despite the persistent, especially in rural areas where across education remains still challenging, menopause is a natural biological transition, often lacks adequate attention. The average age of natural menopause among Indian women is 46.6 years, which is earlier than the global average. Approximately about 14.66 women aged 30 to 39 experience premature menopause with higher prevalence in rural regions. The early onset have profound health implications, including increased risk of cardiovascular diseases and osteoporosis. Cervical cancer remains a significant concern in India, accounting to nearly 1/4 of global cervical cancer deaths. The introduction of indigenous HPV vaccine, Cervac, aims to curb the trend by making prevention more accessible and affordable. The session promotes comprehensive awareness, early screening, and respectful care to empower individuals and influence systems in upholding the dignity of menstrual and reproductive health. Now, let us see how things go. And this is the present trend going on, and I would submit that this matter on cancer related menstrual hygiene is taken forward by the other speakers. Thank you so much.
Merci beaucoup au Dr Chaturvedi. Sans plus attendre, nous allons également passer à la seconde présentation, au second partage d'expérience qui nous vient du Dr Bindu. Elle est éducatrice et universitaire débuée qui compte plus de 30 ans d'expérience dans l'enseignement. Et en plus de sa carrière universitaire, Dr Bindu s'engage activement auprès de Global South Coalition for Dignified Menstruation pour sensibiliser le public à la ménopause en s'appuyant sur sa propre expérience de la ménopause chirurgicale qu'elle a vécue il y a 7 ans. Merci au Dr Bindu.
डाक्टर बिन्दु पौडेलसी नेपालबाट आज अन्तर्राष्ट्रिय मर्यादित महिनावारी दिवसको उपलक्ष्यमा मैले बोल्न पाउँदा म आफूलाई धन्य सम्झेको छु र यसमा रचनावृत्ति के हो त भन्ने कुरा मेरा अनुभवहरू हजुरमाझ प्रस्तुत गरिरहेको छु। रचनावृत्ति 3 प्रकारका भए तापनि नितान्त मसँग यो सम्बन्धित भनेको चाहिँ चिकित्सा रचनावृत्ति अर्थात् शल्यक्रियापछिको रचनावृत्तिको कस्तो अवस्था हुँदो रहेछ त अनि त्यस्ता पेसेन्टहरूले कस्तो अनुभूति गर्दा रहेछन्, कस्ता चुनौतीहरू खेल्नु पर्दो रहेछ त भन्ने कुरालाई तपाईँहरूको माझमा म बाँड्न चाहन्छु। जब मलाई 47 वर्षको उमेरको थिएँ त्यति बेला मेरो पाठीभर मलाई चाहिँ सिस्ट फलाएको र अर्को मूत्रथैली झरेको भन्ने कुरा भयो। त्यसले गर्दाखेरि मलाई समस्या एकदम जटिल भयो। मलाई सामान्य हिँड्न गर्न पनि मलाई असजिलो हुने, अलिक दुखाइ गरेकोले मैले विभिन्न अस्पतालहरूमा पनि मैले पुगेँ, ढोकाहरू ढड्काएँ र धेरै डाक्टरहरूले चाहिँ मलाई अपरेसन गर्नमै सल्लाह दिनुभयो भने केही डाक्टरहरूले चाहिँ यसलाई सामान्य हो जस्तो पनि सोचाइराख्नु भएको थियो। तथापि म यसबाट छिटो समस्याबाट मुक्ति हुन चाहन्थेँ। परिणामस्वरूप मैले शल्यक्रिया गर्न नै अगाडि बढेँ। शल्यक्रियाको 2 महिनापछि 2 महिनासम्म मैले हर्मोनको औषधि चलाएको थिएँ। त्यति बेला मलाई केही पनि भएन। जब 2 महिना पछाडि हर्मोनको औषधि मैले निरन्तरता दिइनँ, त्यसले साइड इफेक्ट हुन्छ भन्ने मैले सुनेँ, त्यसलाई मैले रोकेँ र त्यसको अलावा मलाई विभिन्न किसिमका समस्याहरू देखा पर्न थाले। विभिन्न किसिमका समस्याहरूमा मेरो चाहिँ शरीर सुक्खा हुने, अनि निन्द्रा नलाग्ने, छटपटी हुने, पसिना आउने, चिच्चार हुने, अरू बोलेको मन नपर्ने, अनि खान मन नलाग्ने र उत्तिकै खलखल पसिना आएको छ, उत्तिकै जुगेको छ, अनि एकदम जाडो भएको जस्तो हुने। त्यति मात्र होइन, अनि यसरी एउटा शारीरिक सम्पर्क गर्न पनि त्यसमा पनि चाहना नहुने, यस्ता विविध किसिमका समस्याहरू मैले झेल्दै गएँ। यसरी झेल्दै गइसकेपछि मैले त्यस पछाडि पनि मैले डक्टरहरूबाट गएँ र यसरी जाने क्रममा मैले यतिसम्म गरेँ कि मलाई अरू एकदम खतरनाक कुनै रोग त लागेन भन्ने मलाई त्राईको वातावरण सुन्नुभयो र परिणामस्वरूप मैले चाहिँ त्यस्तो डिप्रेसनको औषधिसम्म लिनु पर्यो। त्यसैले मैले यति धेरै चुनौतीहरू खेप्नु पर्यो, जुन कुरा चाहिँ मैले पहिले मेरो डक्टरबाट अथवा मेरो छरछिमेकीबाट अथवा त्यस्ता म जस्ता शल्यक्रिया गरिसकेका दिदी बहिनीबाट यो कुराहरू मैले जानकारी पाएको भए सायद मैले शल्यक्रिया गर्ने पनि थिइनँ होला। जे होस्, अब शल्यक्रिया गरिसक्यो। त्यसपछिको वातावरण, यस्तो चुनौतीपूर्ण वातावरणलाई कसरी व्यवस्थापन गर्ने त भन्ने क्रममा चाहिँ व्यक्ति स्वयं अनि व्यक्तिको परिवार र त्यस्तै गरिकन कार्यक्षेत्रमा भएका साथीभाइहरू सबैले हातेमालो आवश्यक हुँदोरहेछ भन्ने कुरा चाहिँ मैले महसुस गरेँ र मेरो श्रीमानले पनि मलाई चाहिँ के त यतिकै सहयोग गर्नुभयो मेरो घर परिवार सबैले मलाई साथ सहयोग दिनुभयो यसको म आफूलाई भाग्यमा नै ठान्दछु र व्यक्ति स्वयंले पनि आफूलाई विभिन्न ठाउँमा घुम्ने रमाउने आफ्ना दुःख सुखका कुराहरू चाहिँ अरूलाई सेयर गर्ने यस्तो गर्दै गयो भने चाहिँ पक्कै पनि आफूलाई अलिकति हल्का हुँदो रहेछ र त्यस्तै गरिकन अरू दिदीबहिनीहरूलाई पनि यस्ता जानकारीहरू दिने र अनि जति हामीले यो गर्न सक्यौँ घर परिवारका सदस्यले पनि यसलाई यस्तो किसिमको समस्या छ यो कारण हो भन्ने कुरा चाहिँ सहज एक्सेप्ट गरेर त्यसलाई सहजीकरण गरिदियो भने चाहिँ घर परिवारमा पनि सहज हुन भइ नै हाल्यो त्यस्तै गरी कार्यालयमा रहेका आफ्ना सहकर्मी साथीहरूले पनि त्यस्तै हातेमालो गरिदिनुपर्छ भन्ने चाहिँ मैले महसुस गरेँ र यो सबैबाट यही अपेक्षा गर्दै अबका दिनहरूमा यस्तै होस् भन्ने कामनाका साथ यहाँबाट बिदा हुन चाहन्छु।
Similar things will happen in future as well.
Alors, encore une fois, nous remercions le docteur Bindu et docteur Chaturvedi pour ces partages d'expérience. Comme nous avons pu le remarquer, la ménopause nous fait vivre en fait des défis. Nous devons prendre conscience plutôt des défis sociaux et de santé liés à la ménopause. Le manque d'informations sur ce sujet peut entraîner des situations inconfortables, comme nous avons pu le voir avec le partage d'expérience du docteur Bindu. Et nous avons également pu remarquer que le soutien de sa famille, de ses proches, ont été plus ou moins une solution pour vivre sa ménopause de manière beaucoup plus digne. Et c'est là où nous mène en fait la discussion qui va tenir pour ce panel, parce que nous avons un panel sur la question de la ménopause digne. Et nous allons explorer la différence selon les contextes. Nous avons également remarqué que depuis les 2 derniers jours où nous discutons de la question des menstruations et de la dignité menstruelle, nous abordons très peu l'aspect de la ménopause. C'est donc l'occasion pour poser les bonnes questions et de pouvoir repartir avec la même compréhension sur ce que c'est qu'une approche de cycle de vie dans la dignité menstruelle et de comment, de manière pratique, nous pouvons intégrer ou en tout cas prendre conscience de la question de la ménopause dans nos interventions et de donner plus de visibilité à la ménopause digne. Pour cette discussion, je vais inviter 3 sœurs. Oui, dans mon espace, nous parlons de sœurs, nous parlons de sorcières. Donc, je pense que les dames qui vont me rejoindre sur ce panel sont mes sœurs. Et pour commencer, j'invite Shanta Adhikari, qui est infirmière praticienne familiale certifiée, titulaire d'un diplôme de 3e cycle obtenu aux États-Unis. Elle occupe actuellement le poste de secrétaire générale de la Society of American Nepalese Nurses, une organisation qui se consacre à soutenir les infirmières népalaises et à promouvoir l'éducation et les services de santé au sein des communautés népalaises aux États-Unis. Shanta est également la fondatrice de Dignified Menstruation Incorporation, à travers laquelle elle milite pour l'égalité menstruelle, la dignité et l'autonomisation des femmes et des filles dans le monde entier. Et je vous prie de l'acclamer. Merci. Ma seconde sœur est la fondatrice et l'administrative du 𝐼𝐭𝐳 Charitable Trust et professeure adjointe au département de biotechnologie de Sri Ram Krishna Institute of Computer Education and Applied Science de l'université Sarvanajik à Surat, en Inde, et une fervente défenseur de la santé menstruelle et une éducatrice spécialisée dans ce domaine. Forte de plus de 15 ans d'expérience universitaire, elle est experte en syndrome prémenstruel et a mené des recherches pionnières sur les syndromes prémenstruels et la dysphorie du prémenstruel chez les femmes indiennes. Au sein de 𝐼𝐭𝐳, Elle dirige le club consacré aux règles, encadre des éducatrices spécialisées dans ce domaine et sensibilise le public à la santé menstruelle, tant en ligne que hors ligne, en mettant particulièrement l'accent sur la santé mentale, les règles, le bien-être psychosocial, grâce à des programmes éducatifs, de formation, de recherche et communautaires axés sur la dignité menstruelle. Je vous prie d'accueillir avec moi Dr Nehal Dilip Shah. La dernière, mais pas la moindre, occupe actuellement le poste de professeure adjointe au département d'économie de l'université d'Allahabad, en Inde. Ses recherches portent sur les questions et les politiques liées au développement économique et à la durabilité, en particulier sur les inégalités entre les genres, l'égalité, la protection de l'emploi et la protection sociale. Elle a publié des vingtaines d'articles dans des différentes revues nationales et internationales. Merci d'accueillir avec moi la docteure Rekha Gupta. Alors, pour cette discussion, nous avons 37 minutes que nous devons pouvoir répartir avec le public qui va pouvoir avoir des moments de discussion. Avant toute chose, il est important de clarifier ce que nous mettons dans l'approche de cycle de vie et dignité menstruelle et ménopause digne. Voilà pourquoi je vais me tourner en premier vers Shanta Adhikari pour poser la question à savoir comment devons-nous comprendre l'approche de cycle de vie en matière de dignité menstruelle depuis les premières règles jusqu'à la ménopause et au-delà.
Morning, everyone. Thank you, Floriane, for the question. See, how I see life cycle approach is how I understand life cycle approach is it's a continuum approach process in life, rather than being isolated, of one stage of life, such as menarche or menstrual days or menopausal or postmenopausal days. So the dignified menstruation, when we talk about dignified menstruation or menstrual dignity, we think of, well, this is probably for 1 day or 3 days or 5 days of bleeding period, or during, nowadays even during pregnancy and menopause, we have slowly added these steps or stages of life. In menstrual dignity is not dignity until we include menopause, pregnancy, and all of it in life cycle approach. So menstrual, however, dignity is, is centered. It's a human right approach. It's a center to the individual, and regardless of their gender identity, and male, female, LGBTQIA, and including men or boys. So, in another word, this approach teaches a simple truth. Dignified menstruation is human right approach in every community and every individual's life. When we honor this right, we not only improve the life of an individuals, but also the complete society. So therefore, how I think menopause is dignified menstruation is a life cycle approach when we include a fetus menstruator, the 5-year-old child, girl, or the menstruator, 15-year-old, 20-year-old, 30-year-old, 40, 50, every stage of life, including until the death of post-menopause menstruators. The dignified menstruation starts when mother conceives, or one menstruator conceives a fetus, and that continues, or even doesn't end at menopause, that continues throughout the life cycle.
Merci beaucoup. Je comprends donc, ou en tout cas nous comprenons donc que l'approche cycle de vie en fait prend en compte toutes les étapes de vie, que ce soit la puberté, que ce soit l'adolescence, que ce soit la grossesse, etc. Toutes les étapes de vie d'une personne menstruée. Et c'est ce qui me pousse également à me tourner vers Dr Nehal, parce qu'en fait souvent lorsque nous parlons de dignité menstruelle, on a l'impression qu'on ne parle pas de ménopause. Donc, pourquoi, selon vous, la ménopause est souvent oubliée ou cachée?
Thank you for that question. Before I would like to answer the question, I'll quickly brief in a minute about menopause so that those who are not much into it would like to know the seriousness why we have a session on menopause. So as Dr. Bindu had pointed out her journey, menopause usually begins somewhere between 45 to 55 years of age. And when one would be considered in menopause, if the menstruator misses the menstruation for at least 1 full year, then clinically and medically it's considered to be that the person is in menopause. And prior to this menopause period, the menstruator is very likely to suffer lot of symptoms which are not being noticed by the menstruator, at the same time is not being addressed by the medical field as well. And that is one big gap that we need to address rightly. So sometimes nowadays, as somebody told about the farmers and the agriculture field, that because of the chemicals, this cycle is changing. Same way, menopause period is also changing, and we are seeing that the menstruators are very much now stepping into early menopause, which is enhancing and bringing the symptoms into a more severity. That is known as pre-perimenopausal phase, which can be of at least 5 years, and wherein the menstruator may feel hot flushes. So she has a very rapid change in the body temperature. The homeostasis changes. Lot of changes in her mood swing. She can be into depression, sleep deprivation. Her libido will decrease. She will suffer vaginal dryness, leading to pain during sex. Loss of calcium, as the estrogen, progesterone hormones, they are getting disturbed highly. And lot of brain fog, which leads to her malfunctioning in her day-to-day life. And this, when is actually a part of menopause, she has a lot of emotional issues because she herself is not able to understand what's happening to her. Many a times women gain lot of weight. Maybe the weight goes from 5-7 kgs to 10-15 kgs abruptly in few months, and that is a big shock for women, as women particularly are being identified by their body. So they are being validating their body. I should look beautiful, I should have a good body, and that is what pressurizes them more. And we need to address all of this, and that's why to talk about menopause is so very important. And now coming to the question, it has to be a part of anything which is human rights. because menopause is a phase of female, which is again a natural phase. When you consider the phases of the menstruator's life, you're talking about a human life. So it directly implies that if you have a human, you have human rights. So obviously you cannot neglect that you don't have to consider menopause into human rights. You need to include it for sure, and in a very correct way. And we need to redefine our menstruation concept also. So we only usually talk about 5 days bleeding or maybe the phases of the cycle, but we forget that the cycle ceases. It stops naturally and it needs to be addressed also. Now, I see the gap again with women, particularly with women themselves, because a larger mass of menstruator is usually women. So they are not themselves aware about this, and this goes into their upbringing, because usually women are not trained in a way to speak about themselves. There's a lot of lack of communication, and the core element, if you see from psychological point of view, which is what I have studied throughout these years, is lack of self-respect and self-love. If we can incorporate this factor inside our training programs, in our awareness, then you don't have to do much about all these aspects, because she herself will be empowered to talk about herself. So we need to incorporate how we can enhance this factor of self-love and self-respect in her, and how she can regain her confidence, which is lost because of her upbringing, which is wrongly stigmatizing her that she has to remain sabotaged or she has to remain under somebody and she cannot have her own stand or her own views. So if we can do that, maybe a lot of things will improvise on a subtle level, and our work will become a little bit easier. I hope I answered the question. We can go on, because I'm a professor, I can continue speaking. So please let me know the timings as and when. And I have lots to say, so feel free to inquire and we can have a very good discussion. Thank you.
Merci beaucoup, Dr Nehal. Donc si je comprends bien, il s'agit également d'un silence et d'une invisibilisation du vécu autour de la ménopause. Les personnes ménopausées, ou en tout cas les personnes menstruées qui vont quand même vivre la ménopause, ne sont pas au courant de ce qu'elles vont vivre durant la ménopause, et donc c'est un peu comme une situation cachée ou invisibilisée. C'est bien ça. Du coup, je vais passer à Rekha pour demander en fait comment est-ce que la discrimination se lie à la menstruation ou à la ménopause, pardon. Comment peut-elle être considérée comme des violations de droits humains? Si vous pouvez nous donner des exemples précis pour nous permettre d'illustrer cela, je pense que cela nous aiderait.
Good morning, everyone. To establish the relationship between discrimination based on menstrual life cycle from menarche to menopause, and specifically focusing on menopause, with gender-based violence and the violation of human rights, here I am mentioning the two lenses, and I am trying to correlate with menopause and gender-based violence and the violation of human rights. So basically, two core human rights are that dignity and the equal opportunity to all. So first I'm talking about the dignity. So dignity means the right to be treated with respect. So I have two lenses to describe this relationship. So first one is humanitarian lens. So in the humanitarian lens, when we talk about the dignity, the right to be treated with respect, as well as the state of quality being worthy, or can say that give value of your life. So in the humanitarian lens, we can say that if there is any kind of discrimination, like the deprivation from the menstrual product, not having understanding of family and society, what kind of changes is happening in women body or menstruator body during the menopause, and commenting on that. So such type of behavior and the exclusion of menstruator or the menstruator who is passing through the menopause phase from anywhere, or any kind of challenges they are facing, such type of things automatically reduce, or we can say that is the a kind of dignity gap. So because women herself in their own eyes didn't value their own life. So if we remove such kind of discrimination, which we can also consider as a gender-based violence, then we can protect the women, menstruator human life, a life which lead with dignity. And my second lens is the economic lens. So in the economic lens, I am focusing over the one of the important human right, that is the equal opportunity to all. So from the economic lens, how worthy we are for our society and economy. So if we go through the economic lens and economic theories, so menstruators are not only the human capital itself, because of the labor productivity, but also the provider of future human capital. So, so menstruators with the ability of reproduction. So menstruators are also, we can say that, have a very good value in our economic lens. So if there is not a menstruation life cycle supportive workplace, so it means if such type of workplace is not in our economy, our society, it means menstruators are depriving from the equal right to opportunity. So this is also a kind of violation of human right. So from both of lenses, if go through, so menstruators have a good value and should be respectable in her own eyes, as well as the society or economy's eyes. Economies has also value because of the labor productivity. So both, if there is deprivation of proper menstruation production, product and accessibility, as well as the supportive environment, support from the family during the menopause, menarche. So these all create the gender-based violence, and it will be the violation of human rights. So I just hope so I have give the answer. Thank you.
Can I add something to this? So I think those who are married, they would be much backed up by their husbands if there is some kind of awareness between the couple. Because there is a lot of lack of communication about the menopausal phase of the wife to that of the husband. And if that is where we can break the silence, then maybe lot of support, family support can be automatically generated. Because this particular relationship also has a lot of impact on the emotional aspect of the women who are approaching age. Because they feel that because they are into menopause, they are losing their youth, they are of no worth anymore. And this definition of losing their worth really brings them into clinical depression at a very later stage, which again goes unnoticed. They are not able to be into their relationship in a satisfied way. Which will increase the gap between the husband and the wife, as she is not able to explain why the libido has gone down and what are her problems, and there is no formal education to both of them related to menopause. So if that core element is, if we address that, maybe lot of familial issues can be easily controlled, particularly in this patriarchal society, as men can speak for women. And that can generate a lot of empowerment to her in the family, with the elders, with the children, and bring respect to her.
Docteur Nehal, merci beaucoup. Je reste avec vous. Docteur Nehal, je reste avec vous. Vous avez commencé par répondre à une question que j'avais envie de vous poser, qui est de savoir comment la stigmatisation, le silence et les normes sociales façonnent les expériences des personnes ménopausées. Oh, there is a problem with the traduction. I will stay with you, Dr. Nehal. I wanted to know how stigmatization, how social norms, and how silence and emotion drive the life of the people who live the menopause. What is the impact in their social life, in their familial life, in their activity, professional activity? I think you start to answer that, so I want you to continue on that. And if you can give us 2 examples to illustrate that, it will be good.
Okay, thank you for that. So I think I had partly talked about it, how it can be, how it's been generalized and how is the emotional state and what kind of relationship issues she might be having at home front. I'll further go with it. Most of the women, they are afraid to be aged. And when they step into menopause, either they normalized it in such a way that they don't see that it comes with lot of health issues also, which needs to be addressed. And because she herself is not aware, she's not able to communicate that to the family members or at the workplace. So as I described previously, there is a brain fog, and unfortunately we don't have much research also coming up in this cognitive effect related to women's functioning during this kind of phases. But brain fog is created because of the hormonal problems within her body, and it's a very natural thing happening to her, phasic or maybe for a long period of time, means many years. Now because of that, she has boredom, burnout, she's not able to think correctly, produce a response correctly, she feels extremely low, her confidence level goes down. Now this is not known to her, neither to her family nor things at workplace, because workplace demands you to be extremely productive all the while, and in case of women that's not possible. I don't have a chart, I'm so sorry, but there is a difference in the way female brain works and men brain works depending on the chemicals within our body. So men can continuously work 24/7 in certain way because they have testosterone. Women work phasically. So during her cycle, she is most reproductive at certain phase of her cycle. Now this understanding is not there in our society, in family, at workplace, anywhere. And because of that, what happens, there is a big gap of understanding between both the sides, the women at the same time, the people on the other side of it. And because of her nature, because she is brought in such a way that she is taken granted by everybody, and she allows that to do. I would also partly blame women for this, that she herself doesn't stand up for her own, and she's taken granted. So if she says, I have a headache, or if she says, I don't feel like doing this work, people don't take this seriously. And that creates more problems amongst the family. Moreover, this phase is approaching by 40s. So if you have gone through, everybody suffers a midlife crisis by 40. It's a very natural process with human body. And your body changes every 7 years. So this all impact along with the menopause increases the overall effect that she is suffering unnoticed, unknowingly, and leading to a lot of problem. And it's very difficult at workplaces because they are very demanding. Certain people, they lose their job if they are not active or efficient. And many of the people, they would change their jobs by 40s also because of this one reason, that they are not able to do the work the way they were able to do it at 20s. But they don't know what's actually happening with them. And the most common issues are also with divorces, because many in India particularly, I see now the increase in divorce cases after 45 particularly, because this gap is there, and she feels that I need some space and time for myself, and she's not able to explain it. And that the major core between the couple is about the sexual activity, which reduces drastically as she doesn't have that kind of libido due to dryness. Now, if this all has been a part and parcel of the curriculum, or at least if the medical professionals explain it to them rightly at right time, maybe things change. Now, people don't go for screening because they think it's very normal, so why should we go for screening? So as the previous video, sir was telling that vaccination and cancers are increasing because people are not aware that menopause brings a lot of chemical changes which needs to be addressed timely, and screening is required. So it's a vicious cycle, one leading to other leading to the next, and ultimately everybody suffers because women is the core element of the family. If she is not active, children are not working in certain way, husband is not happy, the in-laws are not happy, the whole family suffers directly or indirectly. So we need to see to it that we address along with the phases also about the menopause whenever we are training or doing some awareness sessions with this particular couples or maybe women or maybe the mass.
Thank you. Du coup, de ce que vous venez de nous partager, there is a traduction in English? Okay. Non, ça va aller, merci beaucoup. Ok, donc je vais y aller. Donc merci beaucoup, docteur Nehal. Et je pense que dans ce que vous avez partagé, il y avait également la question du fait que les personnes menstruées elles-mêmes ne comprennent pas forcément ce qu'elles vivent. Du coup, je vais me tourner vers Shanta pour savoir si les personnes menstruées elles-mêmes ont du mal à savoir ce qu'elles vivent. Quel est le rôle des personnes non menstruées pour aider une personne qui est en cours de ménopause ou qui vit la ménopause à la vivre de manière digne? Comment est-ce que les personnes non menstruées peuvent aider une personne en cours de ménopause à la vivre de manière beaucoup plus digne? Dr. Shanta? Okay. Do you understand what I said?
All right, thank you for the questions. It's very tricky how, who needs to recognize and who needs to be supported, by whom. Actually, I had a conversation with my colleague at work. He's OBGYN, and we had discussed whether or not menopause and menopausal symptoms. And we study about menopausal symptoms, just like Dr. Nehal said. There are multiple symptoms such as hot flashes, night sweats, vaginal dryness, frequent urinary tract infection, and so forth. And it causes major disruption in their work and home life. Now, are these education included in healthcare or in healthcare providers' manual or not? Is it included in medicine book? Is it trained in school? Or, is it practiced in the community? That's the question we have. Now, lots of time, menopause is not recognized as, menopausal dignity is not recognized as a human dignity or dignified menstruation or human right issue and so forth. Therefore, dismissing, mocking, making jokes about the symptoms can also prevail in the community. Now, how non-menstruator can help or support menstruators through the menopause is a question. We're all in different section of life, working differently and engaged in community and family differently. So out of all of us, we're probably are in multiple different sector of work life, right? So some could be priest, some could be teacher, some could be journalist, some could be medical healthcare provider, and so forth. Now, these people are in really, good setting to change the myth, to change the narrative about menopause. Now, they can help non-menstruator can help menstruator by listening and believing the lived story. We already heard Bindu and Vasudev, Bindu did his lived story. That story touched and it felt like home to me because I'm at that stage and, I'm perimenopausal. So all these symptoms that we discuss is not imaginary, they are real, and that they hurt. Even muscle and bone joint hurt during perimenopause, menopause, and postmenopause. Forget about postmenopausal state. Oh my God, that I have had examined multiple postmenopausal women. So when I was examining their pelvic, vaginal thinning, pelvic floor, uterine prolapse, the vaginal prolapse and all that, made me feel very sad and very upset in health system because we have some resources that we know of and that resources was not being spread to the community. Medical doctors, primary care provider, OBGYN are not prescribing estradiol vaginal cream early on, premenopausal or perimenopausal, or even menopausal state causes all that too. And it's not quick fix. It is continuum process, but it can causes that, changes too. And challenging the stigma and silence in the community. So community and religious leaders, oftentimes I have heard that it's our dharma, parampara, or sanskriti to kind of hold on to these menstrual restrictions. However, if they want to learn the fact, biological state, natural state, and human right aspect of it, And also, if we're able to encourage enough priests, religious leaders, community leaders, we can probably, as some percentage, educate community to dismiss to dissolve the myth and stigma in the society, instead of keeping menopausal individual silence. Now she could talk about it. And next, creating supporting environment. Decision makers can be, decision makers can be at workplace or community or at home. Let me touch upon the decision maker at work. The supervisors, managers, administrative staff, human resources staff, if they are educated about menopausal symptoms, menopausal issues that goes on, not just physical, but also emotional and social aspect of it, then they probably could include gender equity, anti-discriminatory measures by providing space for the rest period, including flexible schedule and so forth. But instead, like we discussed, we have received so many complaints from menopausal women that they are slowly their hours are being cut, and they are slowly being removed from the workplace.
Thank you.
And also using their platforms. For example, journalists, I have seen some journalists here and amazing non-menstruator allies. They can take their message to the community and spread the facts about dignified menstruation and menopausal dignity. Encouraging inclusion the making policy in the community policies, that is another way to policymakers can help non-menstruators to live quality life, dignity life, or at least somewhat comfortable life during their menopause and postmenopausal state. And last not the least, the family, friends, and relatives are there around us, around all menstruators. So providing practical emotional support to menstruators during menopause phase is really important. At home, if mom is not able to cook sitting in front of the firewoods or hot stove, maybe family member can be assertive and work on that. Although I'm not saying it's mom's job or menstruator job to cook and feed the family. It's everybody's job because everybody needs to eat. However, in society we have seen head of the household, when we make financial decision, it's the male. When we make food decision about the food and care and so forth, is women's decision. They're involved in caring for children, caring for elderly, and they may not be able to provide quality care to the children and elderly during this symptomatic period. So family and friends can support them, emotionally in practical ways.
Merci beaucoup de Shanta. Et je pense qu'il ne nous reste pas beaucoup de temps, malheureusement. OK. It's OK. Et donc, je vais partir avec Rekha pour que tu nous partages un peu, selon toi, comment pouvons-nous réellement reconnaître la ménopause comme un droit humain et non comme un problème de santé publique secondaire. Comment est-ce que nous pouvons travailler sur les politiques, sur la culture, sur l'inclusion, dans les programmes, dans notre manière de travailler, surtout avec une approche intersectionnelle, en prenant en compte la diversité des personnes menstruées que nous avons, notamment les personnes en situation de handicap, les personnes LGBTQI, qui menstruent également. Je pense que Dr Shanta avait commencé déjà par parler du support en fait que les personnes non menstruées pouvaient apporter dans l'évolution de cette thématique. Et aussi, elle avait abordé également la mise en place de politiques publiques. Donc, de votre part, de votre position, que pensez-vous que nous pouvons réellement faire pour faire évoluer la question et parler plutôt de ménopause digne plutôt que de ménopause ou même de invisibiliser la question de la ménopause dans nos milieux et dans notre manière de fonctionner. Et je vais vous demander d'être assez bref parce que là, on n'a plus de temps pour terminer notre session. Merci.
Yeah, policy making. So being an economist, I can say that, so this is unfortunate, we can say that. WHO has recognized the menstruation problem, but didn't give any global government guideline across the nations. And we also can see the lacking of policies across the nations focusing over the menopause. In fact, UK is the leading nation which is developing menopause-focused policy, particularly in the workplace. So this is a very big gap, we can say, in the policy related to the menopause issues. If we have to recognize the menopause, then first, being an academician, so my opinion is, first of all, we have to give the place of menopause-related issues in our theories. So, I told about the economic lens. So, why there is the policy related to maternity benefit? Because the maternity, it means the women dropping from the workplace has given a particular space in the production function theories of economics. So if we are able to give the proper place in our theories, how the menopause related issues is adversely affecting the production and productivity of a nation or income of a nation, then it can be possible that policymakers will highlight such type of policies in their, or they integrate such type of policy in their national health policies. I just wanted to give an example that in India, the 2022 Right of Women to Menstruation Paid Leave bill has passed. Yet only two states, Bihar and Kerala, was providing the 2-day paid leave during the menstruation period in a month. Now recently, Karnataka has become the first state of India which has granted 12 menstruation leave annually across the sectors. It means both government and private sector. Previously in Bihar and Kerala, it was only for the government sector. Why Karnataka has made this policy? Because Karnataka is a leading state of IT sector in India. And IT sector needs the high-skilled manpower. Menopause is our menstrual cycles. Due to the menstrual cycle, women are more or less dropping from the workplace, and they need that productivity for their income and the annual growth. So, I think if we are able to highlight such type of issues in our theories, we will able to collaborate, or I think such type of studies now is increasing. Japan is a nation which is highlighting such issues, that the problem related to menstruation cycle on the labor production and productivity, menstruator production and productivity. So if such type of research is happening, and we are giving the importance of such type of output in our theories, so policy makers will be compelled to make policies focused on the menopause related policies. So this is the thing. And if we are talking about the LGBTQI community, so in my opinion, this is just like if we are giving a space equality, and we see that whatever we have, the biological body, that is natural. There is no difference. So if such type of acceptance will happen, then automatic the issues, all issues will resolve, and the policy will include this issues. Okay. So I think so. Thank you.
Merci beaucoup. Malheureusement, notre temps est dépassé, ce qui fait que je vais juste faire un résumé de tout ce que nous avons dit à cette étape. Donc, lorsque nous parlons de dignité menstruelle, nous incluons la ménopause, faisant partie du cycle de vie des personnes menstruées. Elle ne devrait pas être invisibilisée ou oubliée dans nos approches, dans notre demande. Et le rôle des personnes non menstruées également reste important, et leur rôle est d'écouter, d'être bienveillant et de valider l'expérience des personnes menstruées qui vivent la ménopause ou pendant toute la durée de la ménopause. Et pour mieux visibiliser cette question de ménopause, nous avons besoin de plus de recherches universitaires, de plus de recherches médicales sur la question, mais avec toujours une approche bienveillante et une approche respectueuse des personnes concernées. Lorsqu'il s'agit de mettre la question de la ménopause au-dessus, ou en tout cas visibiliser cette question, le rôle des politiques aussi reste important. Les politiques publiques doivent prendre en compte en fait la question de la ménopause. Très souvent, le corps des personnes menstruées est plus valorisé au moment de la reproduction. Mais par notre travail, par nos demandes, par nos plaidoyers, faire comprendre aux populations, que ce soit au niveau communautaire, dans nos familles, au niveau politique, que la ménopause fait partie de nos questions, de nos vécus et doit être prise en compte de manière digne pour nous permettre de vivre tout cela. Et aussi, dans notre manière de travailler, notre approche doit rester intersectionnelle. Oui, nos corps sont les mêmes, mais nos expériences varient d'un contexte à un autre. Et nous devrons toujours prendre cela en compte. Et pour terminer, clôturer cette session, ce que j'ai envie de vous dire, c'est soyons le changement que nous voulons voir. C'est-à-dire que prenons en compte le plus possible dans nos interventions la question de la ménopause. Soyons nous-mêmes intéressés par cette question de la ménopause parce que très souvent, en tant que personnes menstruées, nous oublions que nous allons atteindre cette partie-là et vivre la ménopause. Donc, nous sommes les premières concernées, donc intéressons-nous à cela. Et je vous demande également de remercier mes chers panélistes, à qui malheureusement je ne vais plus donner la parole parce que nous avons dépassé notre temps et que je pense que les gens sont également fatigués. Merci pour vos partages, merci pour vos expériences qui nous ont enrichis et encore une fois, merci de nous avoir partagé tout ça.
Thank you so much, but I cannot leave the session without sharing two important things.
Okay.
And that is, we need to make a very loud noise. And for that, we need to come together. Since day one, we are listening to a song related to Sangh. So let's not end up this 3 days journey going back home and forgetting things. But we need to remain as a Sangh and make very loud noise related to the work that we are doing. Come together and it should be visible. She rightly said a lot of research is needed. Lot of background science needs to be brought in front, and then only these topics would reach to the policy makers in the right way. Thank you so much.
Yes. And you can approach them after to discuss with them if you have some questions. Thank you.